Breast lift is a procedure that can get you firm, attractive breasts without implants. Dr. Rajat's clinic offers this simple and safe procedure that can be the answer to your frustrating problem.
So when we do a mastopexy surgery or any breast aesthetic surgery, we consider 2-3 things. One is that the volume of the breast should be good for that body. It should not look too small for their shoulder size. It should not look too big as well, because it doesn't look aesthetic. It should be just the right size. The other thing is that the skin envelope should be enough for that volume. If it is bigger or it's left bigger, the breast will tend to sag. And the third thing is that the nipple areola complex, or an NAC complex what is called, should point in the front. It should not point down. Sometimes also the breast volume, you will see the breast shape, females have more volume in the inferior portion and their upper portion becomes totally flat. So we also consider this when we design a new breast. We can also consider the middle cleavage aspect. So some women will have a very widely placed breast, and when they wear dresses, their cleavage won't show. So these things are also taken care of while we design a newer youthful looking breast. The way we do a mastopexy surgery is the patient comes to the hospital early morning. We do her surgery. Usually the surgery takes a couple of hours, maybe less than that. And then the patient usually is kept under observation for next few hours and goes back home the same day. We use some nerve blocks during the breast surgery, and the patients are actually without any pain. They'll have some discomfort or a kind of a stretching feel because now their breast is tightened and lifted up. Other than that, there will not be pain. For this discomfort feeling, we'll give them basic painkillers like diclofenac. No stronger painkillers are actually needed. They just have to wear a sports bra for 6 weeks and avoid heavy weightlifting exercises for 6 weeks. Now, when I say weightlifting exercises, they can lift their weights with their biceps and all. I don't want them to lift their weight over their head. That is something which has to be avoided. That's it. If done properly by a good plastic surgeon at a good hospital, it's a reasonably safe procedure. You don't have to worry about. There are certain side effects like bleeding, infection and all before any procedure or any surgery, and every plastic surgeon takes care of these side effects much more of what you can even think. Many times I get patients asking that they want an increase in size of the breast, and when I examine them, actually they also have a breast sagging or the breast is drooping down. Now understand that if I just put an implant which is a weight on a sagging breast, the breast is going to sag more, isn't it? It's pretty obvious. So what we want is to lift that breast up, do a mastopexy, and at that time if she wants to augment the size, then we can always do an implant. But if the breast is sagging, you definitely need a lift. Whether you need an implant or not, that's a secondary question depending upon whether you need an increase in volume or not.